Hello, Uganda. My name is Mwanguzi Shadrack from Health Touch Uganda. Today I'm going to be talking about pregnancy and childbearing in the face of the pandemic. Many people have been asking a number of questions, and I'm going to be addressing some of them. And if you feel there is one I have not tackled and you want a response concerning that, feel free to channel them through our official social media platforms, that's Facebook, Instagram, Telegram, Twitter, and YouTube, so that we organize and arrange for a special session and answer them as well. So some people ask, are pregnant women at higher risk of getting COVID-19? I want to say no. There is no special risk that a person gets because they are pregnant. The same way COVID can catch a pregnant lady is the same way it can catch someone who is not pregnant. So there is no special risk, because some people think because when you are pregnant, sometimes your immune system may tend to go a little low, but that doesn't put you in danger, or that doesn't make you more liable to getting COVID-19 than any other person who is not pregnant. However, when you're pregnant and you get COVID-19, you may be at risk of the more severe form of the disease. Those are two different things. Here, we are saying you are not at a higher risk of getting COVID-19 than the other people who are not pregnant in the society. But when you get COVID-19, just like any other person, your risk of getting the severe form of the disease may be higher. And that's why, as a pregnant lady, you're supposed to even be more cautious, because for you, when you get it, you may be at a higher risk of getting the severe form, which may even result into early childbirth before time. So if you're pregnant, please take more precaution. Plus, the people around you, they are also supposed to be more cautious, because for you may take precaution, but they get it and bring it to you. So pregnant should be more cautious. The people of your household should also be more cautious to ensure they don't bring this COVID to you, because they may put you in more danger. Other people ask, I'm pregnant. How can I protect myself against COVID-19? This is not different from what the rest of the people have to do. You are supposed to take the same precautions. Say, when you're in public places, which in the first place you're supposed to avoid as much as possible. But if you find yourself in a public place, maybe it's unavoidable, ensure your mask is on. Preferably a medical mask, but if you cannot afford one, you can still use these improvised masks that we make at home. But ensure to put on a mask when you're in public places. But if you can avoid public places, the better. When you're with people, make sure there is a bit of distance from you and those people, because we have come to learn how this virus spreads. And make sure you practice good hand hygiene. Wash your hands regularly with soap and water, and if you cannot afford that, maybe you can use a sanitizer, hand rub sanitizer, to ensure that you keep safe and you keep clean. Those are some of the ways you can use to prevent yourself from getting COVID-19, just like any other person in the society. Other people ask, should pregnant women be tested for COVID-19? The answer is yes. Just like we test other people, even pregnant women are supposed to be tested, and the test conducted does not in any way affect your pregnancy or your baby that you are carrying. Others ask, can COVID-19 be passed from a woman to her newborn baby or to her baby inside the abdomen? Up to now, research has been done and there is no evidence. It has not been found out that there is a possibility of this virus being transmitted from the mother to her baby inside the womb. So I want to say, you shouldn't worry, don't panic. Even when you test positive, you shouldn't worry about your baby inside. There might be a possibility, but from the studies done so far, the evidence of that transmission has not been found out yet. Others ask, do pregnant women with suspected or confirmed COVID-19 need to give birth by caesarean section? Caesarean section is when they cut you and remove the baby. Commonly we call it Caesar or Echiso in the local language. So there is no special indication in people with COVID-19 to deliver by caesarean section. It's other indications, just like we have had them even before COVID, that will make the doctors advise you to deliver by caesarean section, but not based on COVID-19. So you shouldn't worry that because you have COVID-19, now they are going to deliver you by caesarean section. It is those other things like people who have been operated on more than two times or more, people that have been operated on in the recent past, less than 2 years, people who have very narrow bones, people who have people who are bleeding, people who have those other indications are the ones who are advised, but not necessarily because you have COVID-19. Others ask, can I touch and hold my newborn baby if I have COVID-19? And I want to say, yes, you can hold, breastfeed, you can touch your baby even when you have COVID-19. The risk of transmitting to your baby is there, but the risk of your baby suffering severe forms of illnesses is higher when you don't interact with them, when you don't breastfeed. We handled most of this in one of our videos. If you have some time, you will go and look up on YouTube or Facebook a video entitled Breastfeeding in COVID-19. So it is okay, you can go ahead and breastfeed your baby, sleep in the same room with your baby, touch and hold your baby, and interact with your baby even when you have COVID-19 or even when you're suspected to have COVID-19. How you can do that in the best way possible to minimize transmission to your baby, you'll find that information in that video. Muwanguzi Shadrack, Health Touch Uganda, follow the light.